Welcome to today's Compass webinar with Dr. Eric Bricker. Dr. Bricker currently serves as the Chief Medical Officer for Compass. He is a Johns Hopkins trained family physician with experience in practicing medicine, as well as hospital billing and claims and employee benefits administration. Today, Dr. Bricker will discuss the strategies for the most costly prescription categories and specialty pharmacy. Without further ado, here is Dr. Eric Bricker with the prescription solution.
Okay, great. Thank you so much, Emily, and thank you to all of you for joining our webinar today about prescription medication. So I am the Chief Medical Officer of Compass Professional Health Services. As Emily said, I'm a primary care physician, did my training at Johns Hopkins in Baltimore. Just a quick 30-second background about myself and what we're going to do is in a whiteboard sort of format today. We figured we'd change it up from just traditional PowerPoint and actually do some sort of interactive whiteboarding with you folks as well. And so, let's see if we can get that. Okay, I was just making sure that you could see the screen appropriately. So, before I went into medicine, I was a hospital finance consultant. So I used to be back in the billing and business office of large medical centers dealing with all the same claims issues that employers and health insurance carriers have to deal with. But I was on the flip opposite side of the claims because, believe it or not, a lot of doctors and hospitals actually have no idea how to get paid. So they hire outside consultants to come in and show them how to do that. So basically, wanted to take that expertise both clinically and from a hospital billing perspective and bring that to companies and their employees, and that became much more important as we moved to more high-deductible health plan and consumer-directed health plans where employee benefits consultants and employers were asking employees to be better healthcare consumers, and people were like, okay, I have no idea how to do that. So that's where folks then hire our tools and support for healthcare consumers at Compass to support their employees alongside a CDHP or an HDHP. And a lot of the assistance that we provide for members is around prescriptions, specifically high-cost brand name prescriptions. So we're specifically going to talk about brand name prescriptions, both in the sort of traditional pill format, but also in specialty format as well, and how being a better healthcare consumer can actually help you still, get, high quality care, great medicines, but do so in a much more cost-effective manner. So what we're going to do is we're going to literally go through 12 of those specific medicines, go through their costs, and then address some alternatives for them as well. So, so the first medication that you might often see, whether it's on your pharmacy claim spend or for an individual member, is the medication Nexium. And Nexium is used for heartburn, or what's referred to as reflux, or sometimes is referred to as GERD, which is gastroesophageal reflux disease, just a fancy term for that. And that's where, so Nexium requires a prescription, but even all prescription medications have a generic name for that. So the generic name for Nexium, it has kind of a complicated name. It's esomeprazole. And so there is no generic esomeprazole. So if you go to the pharmacy and ask for generic Nexium, they'll say no, that's not available. For the prescription form of Nexium, very expensive. It's about $271 a month. And that's where it is in the class of medications that are called PPIs, or proton pump inhibitors. And there are other proton pump inhibitors that have actually become generic and are actually available over the counter as well. Probably one of the prime ones that you're familiar with, that you've heard of before, is Prilosec, and Prilosec is now available OTC, or over the counter, and then the generic name for Prilosec is omeprazole. And so this is where members that are prescribed Nexium, they can actually, as an alternative, take omeprazole instead of that. Now notice that the word omeprazole is very similar to the generic name for Nexium, which is just esomeprazole. So really all they've done is added the extra ES to the beginning of the name. And that's because the chemical structure or the chemical formula for omeprazole and esomeprazole are almost identical. And so the technical chemical term is it's a racemic mixture of enantiomers. So there you go. You've learned a little chemistry today over your lunch hour. And that essentially means that the pill, the actual molecule, actually comes in sort of left-handed and right-handed versions. So in other words, 4 fingers and a thumb in both molecules. And the esomeprazole is just the left hands, and the omeprazole is a combination of right hands and left hands. And in the body, it's only the left hands that actually function to decrease the acid in your stomach. So when you're taking omeprazole, the body just gets rid of the right hands. They don't do anything. And so the body's interaction with the medication of esomeprazole and omeprazole is actually exactly the same because it's only the left-handed version of a molecule that's active. So essentially what they did to extend the patent was just sort of put the left-handed versions in the pill and get a new patent on it, give it a new name like Nexium, and so it's sort of a trick that the pharmaceutical companies use to extend the life of their patent for another 17 years. So our members, oftentimes, they will then switch over to omeprazole from a medication like Nexium. And I will add, even on top of that, that there's actually an effort by primary care physicians, and it's a campaign that's known as Choose Wisely, that actually has found that PPIs for heartburn and indigestion are incredibly overprescribed. And in fact, there's a more traditional antacid medication that is almost equally as effective, that actually should be used the majority of the time. And those are what are referred to as H2 blockers is the category, but essentially it is traditional, what you're probably referred to as Zantac, or the generic name for that is ranitidine. And then the other one is Pepcid, which is famotidine. Okay, and these are also available OTC, very inexpensive. And the reason that it actually might be more advantageous to take the Zantac or the Pepcid is that they actually have, excuse me a second, they actually have fewer side effects. So the problem with the PPIs, the PPIs have side effects in that they interact with other medications. One of the biggest ones is Plavix, which is a blood thinner medication. And they've also found that PPIs may increase the likelihood of osteoporosis. And so that's where the H2 blockers, the Zantac and the Pepcid, or their generic versions, have much lower side effect profiles. And so for mild indigestion, it might actually make more sense to take those medications instead. There's a great opportunity where you could literally go from $271 a month, probably down close to around $10 a month, even outside of the insurance, by switching over to one of those different heartburn medications. Okay, so the next medication, number 2, is Crestor. So Crestor is in that group of medications that are referred to as statins, okay? And statin medications are used to treat high cholesterol. And we commonly see these on the list of the most commonly prescribed medications and the highest spend for our groups. There is no generic Crestor. It's still on patent, but there are other generic medications in the same class. There are other generic statins. And so those generic statins are ones like Pravastatin, Lovastatin, Simvastatin, and Atorvastatin. Now, traditional Crestor runs you about $280 a month. The Lovastatin you can get on the $4 list from Walmart. Pravastatin is going to run about $9. Simvastatin is going to run about $12, and the Atorvastatin is going to run a similar $12 to $18 a month. And Atorvastatin, that's the generic form of Lipitor. So obviously, Lipitor was a very expensive medication until it went generic just a few years ago. And so now by taking the generic Atorvastatin or one of these other statins, then folks can still lower their cholesterol and not have to take Crestor. I will tell you, when I was in training at Johns Hopkins, I did not see a physician once prescribe Crestor. We always prescribed one of these 4 statins. And so really, for folks that have high cholesterol, which is very common, obviously, for cardiovascular risk factors, we want to lower that cholesterol because it's good for the health of the overall population. Best to use one of these other statin medications rather than Crestor. It's a much more cost-effective way to still lower cholesterol. Okay. So then the third medication that we oftentimes see as an expensive brand name medication is Cymbalta. Now, Cymbalta is used to treat anxiety, depression, but then it's also used to treat chronic pain as well. There's often an interplay between anxiety, depression, and chronic pain as well. Now, interestingly, Cymbalta will run you about $222 a month, and there actually is generic Cymbalta. The generic name is duloxetine, okay? So now you say, okay, well, great, it's generic. It must be inexpensive, right? Well, not all generic medications are inexpensive. And so, in fact, the generic duloxetine is actually $144 a month. And so for folks that are on an HSA plan or an account-based plan where those copays go away and they're actually paying the dollar amount for that generic, it still might be very expensive, okay? Now, this medication, Cymbalta or duloxetine, is in a class of medications that are referred to as SNRIs. And there are generic, other generic SNRIs. The other very common one is venlafaxine, okay? And venlafaxine can be had for $19 a month. And there's also a very similar class of medications as well that are referred to as SSRIs to treat anxiety and depression. And these medications have been around for years, and they've actually been generic for quite some time as well. And they're medications like fluoxetine, which is the generic form of Prozac, and other ones like citalopram, which is the generic form of Celexa. And so those medications are actually even on the Walmart $4 list. So essentially by going from Cymbalta to one of these other medications, then you're saving upwards of $200 a month or $2,400 a year by switching to these therapeutic alternatives that are generic. Okay. So now the fourth medication, switching gears, is actually it's an acne, it's a dermatology medication that's referred to as Solodin. Okay, oftentimes one of the top 10 or 15 drug spends for an employer. It's actually an antibiotic that's used to treat acne. So it's a pill that's used to treat moderate to severe acne that may not respond to just creams alone. And there actually is then generic, and by the way, Solodin is going to run upwards of $700 a month, so incredibly expensive. There actually is, again, the generic form of the Solodin, and that is called minocycline. And it's the extended release version of the minocycline, so it's a once-a-day pill. And again, that generic minocycline is also about $700. So you think, oh, I'm taking a generic, it's inexpensive. Well, in this case, again, the generic is very expensive. But if you want to take minocycline twice a day instead of once a day, so 2 times a day minocycline, will only cost you $16. So, it's not that much of an inconvenience to take a pill with breakfast and dinner as opposed to just breakfast. Then that cost will literally decrease by upwards of $690. That can be, and this is chronic medication. Typically the course is 3 to 6 months. So you're talking 3 to 6 months time, $700 a month that can be saved by moving to one of these different antibiotics for acne. Now there are still other antibiotics that dermatologists will frequently prescribe for acne. Actually, we see dermatologists at Hopkins prescribe these. So one is called doxycycline. Another one is called Bactrim. So Bactrim is actually the brand name, but they always prescribe it as generic because it's trimethoprim sulfamethoxazole, so it's kind of a complicated name. But both of these medications are on the $4 Walmart list. So there, you're going to be comparing $600 or $700 to $4 a month to effectively treat acne with this oral antibiotic. Okay. Now, the fifth medication that we'll see, going back to cardiovascular medications, is Tricor. Okay, Tricor is a brand name medication. The generic name for it is fenofibrate. And there actually is generic fenofibrate. Again, the Tricor here, very expensive at $219 a month. The fenofibrate as a generic is still rather expensive. It's $146 a month. And what Tricor treats, sort of related to high cholesterol, what it treats is triglycerides. And triglycerides are essentially the fat molecules that, that flow in the bloodstream. And so oftentimes folks that have triglycerides in excess of 150, that's too high. It actually puts you at higher risk of a heart attack or a stroke. And so oftentimes people are put on medications to lower their triglycerides. This is especially true for people with diabetes who often have trouble with high triglycerides. So there are generic medications to treat high triglycerides as well. A very common one is Gemfibrozil. And Gemfibrozil can be had for $9 a month. So you're talking $219 to $9 a month. So you're talking $210 a month difference in moving from the brand name Tricor to the generic Gemfibrozil. Next medication, number 6, is Lunesta. And Lunesta is a sleep aid. Probably have seen commercials for Lunesta on television. Has rather a complicated name, which is why they call it Lunesta. Basically, a Zopiclone. And that Lunesta is not available generic. It can only come in brand name. And the medication for sleep that has often been used previously, probably people are very familiar with, is a medication that's called Ambien. And so Ambien became generic actually quite a few years ago, and the generic form of Ambien is called Zolpidem. And Zolpidem can be had for as little as $15 a month. Now, sometimes people may have heard of Ambien CR, and all that means is there is a specific sort of delayed release coating on the pill. And the Ambien CR is actually quite expensive at $340 a month. There is then Zolpidem CR that is still more expensive. It's about $61 a month. But really, in our experience, especially my experience, seeing patients, most folks were, it was very adequate to take the Zolpidem. They did not need the delayed release pill. But certainly if they did have the delayed release pill, the $61 is far less than what the Lunesta would cost or what the brand name Ambien CR would cost as well. So prescription sleep aids, it's amazing. It's, upwards of 25 to 30% of people in America actually have trouble with sleep at night, so it's very common for people to get sleep aids prescribed. And here is a lower cost alternative that many of our members use. Okay. Next, moving on to diabetes, obviously a medical challenge. Want people's diabetes to be adequately controlled. Some diabetes medications are very expensive and some are very inexpensive. One very expensive one is one called Januvia. Okay, Januvia costs about $325 a month, and there are generic medications that have been used for decades, and they've actually done these comparative effectiveness studies where, you heard, President Obama during the beginning of Obamacare, we need to do more studies of the blue pill versus the green pill. Well, they actually have done these types of studies specifically for diabetes, and when they've done this, they found that the absolute best medication to start out with for diabetes is a medication called metformin, and that is available on the $4 list of Walmart or Target or what have you. And so this is where I would absolutely see patients where the only diabetes medication they were on was Januvia. So even money aside, they should be switched from their Januvia to metformin because that is the best medication. And you actually increase the dose on the metformin until you max it out, and only then would you add a second medication. And the second medication that you would add wouldn't even be Januvia. It would be glipizide or glyburide. And so really, only as a third or a fourth line medication would you turn to Januvia. So there are many $4 medications that can be used prior to using that particular medication. So what I want to do is pause here and say that the important thing to know about all these medications is that they are what are referred to as therapeutic or clinical alternatives. Okay, so in other words, these are not direct generics. So what does that mean? That means that actually a new prescription needs to be written by the physician or called into the pharmacy. With a direct generic, you can just go to the pharmacy and they can just switch you from the brand to the generic. But if there is no direct generic and you have to have a therapeutic alternative, then you actually need a new prescription for, let's say in this case, to go from Crestor to Simvastatin. Okay? And so that's where, whether you're an individual healthcare consumer and you actually have the conversation with your physician to say, well, that's brand, and then the conversation you want to have is you don't want to say, is this available generic? Because if you say, is Crestor available generic, then they'll say, well, no, there is no generic Crestor. What you need to say is there another medication in the same class that is available generic? Is there another medication in the same class or that treats the same condition that is available generic? So in the case of high cholesterol, yes, there is. It's the Simvastatin that is available. Now, a lot of these medications, whether it be just the Crestor itself or the Simvastatin, they're just hard to pronounce. And so that's where we found that our members like to lean on their Compass Health Pro, and we'll get a HIPAA authorization so that we can talk to their doctor's office. But we'll actually have that discussion with the prescribing physician's office on the member's behalf. And essentially what that's doing is it's unwinding a lot of the free samples that are being given out in the doctor's office, where you might get a free sample of Crestor, and so you're like, great, free sample, and so you might get a week's worth of Crestor, but then you're written a prescription for 90 days with 3 refills, and so now you're on 9 months of a very expensive medication, whereas if you had just asked for a generic up front, then maybe that would have been an option for you. So, so it's very important not to just say, oh, is this available generic? You want to say, is there another medication in the same class or that treats the same condition that's available generic? And that will get you closer to getting the therapeutic or the clinical alternative that will still more than adequately treat whatever condition you have, but do so in a much more cost-effective way. And then the other thing that I will add is essentially this practice of using these therapeutic alternatives, it essentially mirrors the prescribing habits of many what are referred to as academic physicians. Because oftentimes academic medical centers, they treat a lot of poor and indigent patients. And so for a lot of these patients, it's literally a choice between their groceries and their medications. And so oftentimes these academic physicians are conscious about the cost of medications for their members because they know that if their patients can't afford the medication, they're just not going to take it. And so essentially what we do at Compass and what's effective to do across the prescriptions for all your employer groups is to sort of mirror or mimic the prescribing habits of these academic physicians. So now what we're going to move on to is specialty pharmacy and how to control specialty pharmacy spend, specifically as it relates to certain medications. And we'll kind of put these into sort of 2 categories. One is for sort of self-administered medications, and the other is for provider-administered medications. So in the first category of self-administered specialty pharmacy is a medication called Humira, which I'm sure many of you are familiar with. It's used to treat rheumatoid arthritis. It's actually an injection. Humira is it costs upwards of $5,600 a month, so it's very expensive. And even with people's Tier 4 specialty pharmacy benefits, a lot of members will end up paying 10 to 20% of $5,600, which is a lot. So our members are very much interested in any alternatives to something like a Humira. Humira is also used to treat other. So rheumatoid arthritis is in a class of diseases that are referred to as autoimmune diseases, where the body's immune system is actually attacking itself. And so in the case of rheumatoid arthritis, it's actually attacking the joints. Okay, but there's other autoimmune diseases that Humira can treat as well, and those are Crohn's disease and what's referred to as ulcerative colitis. And so these are what are referred to as inflammatory bowel disease. So that's an autoimmune disease of the gastrointestinal system. So the Humira can actually be used to treat Crohn's and ulcerative colitis as well. So again, very expensive treatment. Now there are therapeutic alternatives to the Humira. And so one specifically for the rheumatoid arthritis is a medication called methotrexate. Actually a medication that it's a pill. It's been used for very long periods of time. It is effective. It has a side effect where it can cause anemia. So it can cause a low blood count. So blood levels need to be monitored for people on methotrexate. But Johns Hopkins had the #1 rheumatology department in the country, and gobs of their rheumatology patients were on methotrexate, and was very affordable. And methotrexate is less than $10 a month. So oftentimes people will employ a step therapy approach when it comes to specialty pharmacy, and there certainly are steps sort of in between before going to Humira that may be effective for folks. And so oftentimes at Compass, what we'll do is we'll work in conjunction with a PBM to really sort of guide the member through that step therapy process. Oftentimes they'll get it filled, they will have paid for some of it, it'll be denied, or they'll be waiting to get it filled and they'll be upset. So to actually be able to effectively coordinate them through their step therapy program is just one way we've been able to help our members. Okay. Another similar injection specialty pharmacy medication, and by the way, this is number 9, Humira is number 8, is Enbrel. Okay. Again, Enbrel is an injection. It actually works very similar to Humira. It costs upwards of $2,900 a month. It only has an indication for rheumatoid arthritis and other rheumatoid conditions like psoriasis and psoriatic arthritis, which, by the way, Humira does as well. So it does not have the indication for the inflammatory bowel disease. Still very expensive. Again, the therapeutic alternative for the Enbrel is also methotrexate. So that is another alternative, again, for these 2 medications that are injection. They're specialty pharmacy, and they go into that category of self-administered. The other big key with these self-administered specialty pharmacy medications for cost reduction is the strategy of what's referred to as inventory control. And inventory control is very important because oftentimes people will be given multiple vials. So we're talking multiple vials that are costing anywhere from $3,000 to $5,000, and those vials sit in the fridge. And so those medications might be thrown away. They might change the course, and they might not want to use Humira anymore. They might not want to use Enbrel. And so literally, people can have over $10,000 worth of medication in their refrigerators that then just gets thrown out. And so, again, to have Compass work in conjunction with the specialty pharmacy to make sure that people are only getting it filled when they need to and when their supplies run out, and so that there is not some sort of unnecessary stockpile of medication, which will then result in potentially $10,000 of that medication being thrown away. So there is, there are some estimates that upwards of 10 to 20% of these medications are wasted. And so it's not going to take your specialty pharmacy spend to 0, but there certainly is an opportunity within specialty pharmacy from an inventory control perspective to control costs. Okay, so then the next set of specialty pharmacy medications are not self-administered, but they are rather provider-administered. And what does that mean? That typically means that it's an infusion medication, okay? And so the very expensive infusion medications that are often in the top 5 or the top 10 list of drug spend for an employer, this is drug number 10, is referred to as Remicade, okay? Another name for Remicade is infliximab. Okay, and what that AB at the end stands for is that Remicade is actually what's referred to as an antibody. And so what that antibody does, it's actually sort of the shape of an upside-down Y, is it actually targets a particular type of cell in the body that might be causing a problem, And when it latches onto that cell, it actually helps eliminate that type of cell. And so you can think of it almost as sort of a homing pigeon. And so it sort of homes to that cell and then helps the body then get rid of it. And so specifically, Remicade is used for a couple of types of cancers. So it's used for something that's referred to as non-Hodgkin's lymphoma. It's also used for another type of cancer called chronic lymphocytic leukemia. This type of leukemia is typically in people that are over the age of 60 or 65, so not going to be as much as in an employed population. Non-Hodgkin's lymphoma can strike younger adults, so you may see that in the employed population. But there's actually an indication for Remicade now also for rheumatoid arthritis and for inflammatory bowel disease as well, as sort of a step after. So even for folks that are not responsive to Humira and Remicade, then they'll be prescribed, after Humira and Enbrel. So even if the Humira and the Enbrel don't work, then Remicade will then be used as an infusion. Okay, so one of these infusions will cost upwards of $11,500 an infusion. Okay, and a typical course for cancer will be 4 to 8 infusions, and a typical course for rheumatoid arthritis will be about 4 infusions over the course of a year. So you're literally talking $50,000 to $100,000 of spend on these medications. Oh, I'm sorry. Let me go back. The Remicade is that I was talking about. That is, I apologize, I got confused. It's not for the non-Hodgkin's lymphoma and for the CLL. It's just for the rheumatoid arthritis. So take off that cancer one. Okay. So for the Remicade, still talking very, very expensive. The key here with the Remicade in terms of the cost reduction is where it's infused, okay? And so the big choices here are, is it infused at the hospital, or is it infused in an office or an outpatient setting? Because literally these are not going to be billed as pharmacy claims, they're going to be billed as medical claims. And so they're going to have what's referred to as a HCPCS or a J code that they're going to be billed as. And so the hospital will mark it up upwards of 50% more than what the office or the outpatient facility will be. So this is where, in terms of the location for having the Remicade infusion, you want to choose office or outpatient as opposed to hospital. There's even variation office to office, and so this is where we have seen because what happens is the individual office will mark up that Remicade various amounts, and so that Remicade may be 200%, cost 200% more at one particular doctor's office versus another. And so this is where folks, when they're choosing their doctor for their RA or for their inflammatory bowel disease, that we actually will look ahead and see what their infusion costs are for Remicade, and then let members know in advance that if they do have to get on Remicade therapy, what that might potentially cost them, which can help at least them, they still might want to go with physician X, but they'll know in advance what that means in terms of what their Remicade therapy will cost, or they might choose to go to a different physician because they know their Remicade will be 50% less if they go to that different office. Okay, sorry for the confusion there. I was getting my medications confused with the next one, which is number 11, which is not Remicade, but it's rather Rituxan. Okay, so it's the Rituxan that is the infusion medication that is used to treat chronic lymphocytic leukemia, or CLL, or NHL, or non-Hodgkin's lymphoma. Okay, and then for Rituxan, there actually is an indication for rheumatoid arthritis as well. And so this medication is actually the one that costs upwards of $11,500 per infusion, and there's 4 to 8 infusions per year, so you're talking $50,000 to $100,000 of spend for the Rituxan. And it's the Rituxan that's the monoclonal antibody that identifies the problem cells and takes it out. In the case of CLL and NHL, it's the cancerous cells, and in the case of rheumatoid arthritis, it's the immune cells that are attacking the joints that the Rituxan subsequently removes. So again, in the case of Rituxan, the big issue here is where the medication is infused. And again, if it's done in the hospital versus the outpatient setting. And again, if the outpatient setting is owned by the hospital, then the pricing will actually be equal to the hospital. So it actually, if it is an oncology group that has an office that is billed separately from the hospital, then it's that outpatient or that office setting that will be less expensive. And so this is where, when you look at the billing or the contracting, or when we look at our data, we're actually able to identify, okay, well, that's actually hospital billing, or that's actually an outpatient facility that's associated with a hospital, so that's going to be $11,000 at that particular location, versus this other place is an office-based location, and so it may be upwards of 50 to 60% less, so it might be $6,000. So it's not going to decrease it down to $0 or down to $4. There's no $4 equivalent to these medications, but there is a less expensive way. And what's interesting here too is that these are billed as, again, medical claims. So this is going to show up in your medical spend. It's not going to show up in your pharmacy spend. So there's some estimates that upwards of 30% of specialty pharmacy spend is actually hiding in the medical claims, and it's not in the RX claims. So when you're looking at your RX spend and you're like, oh, I spend X amount of dollars on specialty pharmacy, $75,000, $150,000, $250,000, that you actually need to then say, okay, well, there's actually probably another 50% on top of that are in my medical claims that I'm also spending on specialty pharmacy. So it's important to incorporate that as well. And finally, the last medication, so medication number 12 in specialty pharmacy that we're going to discuss, is really the doozy. So this is the one that is estimated this year will have $8.9 billion in sales, and that medication is called Avastin. Okay, and Avastin is specifically used for cancer. It's an infusion medication that's used to treat lung cancer, colon cancer, kidney cancer, and brain cancer. And what Avastin does is I'm going to get to give you a very short science lesson here on a Wednesday. It is referred to as an angiogenesis inhibitor. So what it does is, as a tumor grows in the body, in order for it to grow, it has to have a blood supply. And so what the Avastin does is it actually attacks the blood vessels and cuts them off from the tumor to try to get it to not grow as fast, or to try to get it to at least shrink. Okay? It's only used for very advanced cancers. Okay, so it's not used for early stage cancers, and it's really only been found to prolong life by about 4 months. Okay, and a course of Avastin will cost upwards of $50,000 to $100,000 a year. And so this is where, you know, it's a cost benefit type of medication. In America, we've just said, look, for the additional 4 months of life, whether it's employers, the insurance carriers, or Medicare, we're just going to pay the extra $50,000 to $100,000. In European countries, they might not even carry it. It might not even be on formulary, because they've really found that it's not very effective. In fact, the data around Avastin effectiveness is that it might not even prolong life by 4 months. It might even be less than that. But regardless, sort of as a society, we say we're still going to provide this medication. That being said, it's not a question of maybe you should or should not have Avastin. Again, it's a question of where. Okay, so is it going to be done in the hospital or in a hospital-owned outpatient facility, or is it going to be done in a freestanding outpatient facility or in a doctor's office setting? Because, again, the independent or office or the freestanding facility may be upwards of 50% less than the hospital, because of just the degree that the hospital will mark up that particular cost. And so, with that concludes the 12 medications and the consumer strategies for how to more effectively address costs for that pharmacy spend. You know, for a lot of your groups, they're spending anywhere from 15 to 25% of their overall spend is on RX, and this is where we found that the Compass Health Pro supporting members as better healthcare consumers, we're helping them with physical therapy, with DME, with finding physicians, with price transparency for MRIs, and we're able to integrate the support for the prescriptions at the same time. So it's kind of a seamless experience for the member. And just wanted to kind of sort of bring some of that expertise that we bring to the members to you as well. Just really appreciate the opportunity to share all this with you today. If you'd like to learn more about Compass and what we might be specifically able to do for you as an employer client or for your employees, then I would encourage you to email me, and I can send you a one-page overview on a case study for a large national employer or a case study for a municipality that show over $1 million in claim savings for these groups. So if you're interested in that case study, please email me at ericb@compassphs.com. Again, ericb@compassphs.com. Really appreciate the opportunity to speak with all of you today. We'll be doing another webinar the middle of next month by either myself or one of my colleagues, Dr. Scott Conard. Super excited to be able to work with all of you, and hope you just have a great rest of your Wednesday. Bye now.